Today we are going to talk about the ICD coding guidelines of HIV infection. First of all, what do you mean by HIV infection? HIV, human immunodeficiency virus infection, is a viral infection that attacks the immune system, specifically targeting CD4 cells, which is a type of T cell. Over time, HIV can destroy so many of these cells that the body can't fight off infections and diseases. This leads to a progressive deterioration of the immune system. HIV is transmitted through contact with certain body fluids from a person who has HIV. These fluids include blood, semen, vaginal fluids, rectal fluids, breast milk. Now, what do you mean by AIDS? AIDS, acquired immunodeficiency syndrome, is the most advanced stage of HIV, human immunodeficiency virus infection. It occurs when the immune system is severely damaged and the body becomes vulnerable to opportunistic infections and certain types of cancers that it would otherwise be able to fight off. Code only confirmed cases of HIV infection. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. If a patient is admitted for an HIV-related condition, the principal diagnosis should be B20, HIV disease, followed by additional diagnosis codes for all reported HIV-related conditions. An exception to this guideline is if the reason for admission is hemolytic uremic syndrome associated with HIV disease. Assign code D59.31, infection-associated hemolytic uremic syndrome, followed by code B20, human immunodeficiency virus disease. If a patient with HIV disease is admitted for an unrelated condition, such as a traumatic injury, the code for the unrelated condition, example, the nature of injury code, should be the principal diagnosis. Other diagnoses would be B20, followed by additional diagnosis codes for all reported HIV-related conditions. Whether the patient is newly diagnosed or has had previous admissions or encounters for HIV conditions is irrelevant to the sequencing decision. Z21, asymptomatic human immunodeficiency virus infection status, is to be applied when the patient without any documentation of symptoms is listed as being HIV positive, known HIV, HIV test positive, or similar terminology. Do not use this code if the term AIDS or HIV disease is used or if the patient is treated for any HIV-related illness or is described as having any conditions resulting from his or her HIV-positive status. Use B20 in these cases. Patients with inconclusive HIV serology, but no definitive diagnosis or manifestations of the illness, may be assigned code R75, inconclusive laboratory evidence of human immunodeficiency virus. Patients with any known prior diagnosis of an HIV-related illness should be coded to B20. Once a patient has developed an HIV-related illness, the patient should always be assigned code B20 on every subsequent admission or encounter. Patients previously diagnosed with any HIV illness, B20, should never be assigned to R75 or Z21, asymptomatic human immunodeficiency virus infection status. During pregnancy, childbirth, or the puerperium, a patient admitted because of an HIV-related illness should receive a principal diagnosis code of O98.7 series, human immunodeficiency disease complicating pregnancy, childbirth, and the puerperium, followed by B20 in the code for the HIV-related illness. Codes from Chapter 15 always take sequencing priority. Patients with asymptomatic HIV infection status admitted during pregnancy, childbirth, or the puerperium should receive codes of O98.7 series and Z21. If a patient is being seen to determine his or her HIV status, use code Z11.4, encounter for screening for human immunodeficiency virus. Use additional codes for any associated high-risk behavior, if applicable. If a patient with signs or symptoms is being seen for HIV testing, code the signs and symptoms. An additional counseling code Z71.7, human immunodeficiency virus counseling, may be used if counseling is provided during the encounter for the test. When a patient returns to be informed of his or her HIV test results and the test result is negative, use code Z71.7, human immunodeficiency virus counseling. If the results are positive, see previous guidelines and assign codes as appropriate. If a patient with documented HIV disease, HIV-related illness, or AIDS is currently managed on antiretroviral medications, assign code B20, human immunodeficiency virus disease. Code Z79.899, other long-term drug therapy, may be assigned as an additional code to identify the long-term use of antiretroviral medications. When a patient is seen for administration of pre-exposure prophylaxis medication for HIV, assign code Z29.81, encounter for HIV pre-exposure prophylaxis. Pre-exposure prophylaxis is intended to prevent infection in people who are at risk for getting HIV through sex or injection drug use. Any risk factors for HIV should also be coded.